special United Nations session on COVID-19 with more than 100 world leaders and government ministers coming together to discuss a coordinated response. The pandemic has claimed, unfortunately and tragically, 1.5 million lives and shattered economies worldwide. With news of multiple vaccines getting approved and trillions of dollars flowing into emergency rescue plans, some people are finally breathing a sigh of relief. But how close are we really to a safe vaccine that will free all of us from fear of COVID? How should vaccines be distributed evenly and equally? What role can the United Nations play in overcoming political obstacles? To discuss all these issues and more, I'm joined by Elizabeth Goldberg, Associate Professor from Department of Emergency Medicine at Brown University. Also by Professor Jove Toker from the American Graduate School in Paris. And Mr. Fu Jun, Professor of Political Economy from Peking University. And later on by Eric Bing, epidemiologist and Senior Fellow from the Federation of American Scientists. That is our topic. This is Dialogue. I'm Wang Guan. Professor Goldberg, thank you so much for joining us. It's very early morning hours over there in the East Coast. Thanks a lot. So my first question goes to you. What are your expectations from this United Nations special meeting on COVID-19? I mean, what concrete actions must nation states take right now to combat the virus?
We are so very close to a vaccine being released, at least to our frontline workers. As you know, I work in the emergency department, and every day when I go into my shift, I think we are so close. I just have to hold out another week or two. And so it's so important that the UN is meeting right now to talk about equitable distribution, because obviously people like me on the front lines and also our older folks have been waiting a long time to return to some type of normal life. And we have to make sure that countries receive the vaccine. And that the frontline workers, in particular, are vaccinated soon, because, as you know, in the United States right now, we're experiencing record hospitalizations. We're seeing over 100,000 patients per day hospitalized. We've reached over 1 million cases in only a 1-week time period. And so this is a really relevant, important conference to have right now.
Really great work, great respect to you and your colleagues over there. I remember in one of your previous interviews you said there should be a field hospital perhaps because there was overcapacity over there. What is the situation there like right now? I mean, of course, the United States is combating the second wave of COVID, like the hospitalization, but what is a typical day really like over there for you and your colleagues?
It's a really dire situation. Yeah, it's a dire situation right now. So we have reached capacity in our traditional hospitals. And if you are an emergency department patient and you come into the hospital, you wait for a very long time to get a bed upstairs. And so right now in Rhode Island, in my personal state, we have 2 field hospitals that have opened. Those 2 field hospitals can hold up to 900 patients, but our problem right now is that staffing levels are really low. We have reached a critical point in terms of staffing, and our governor here in the state of Rhode Island is calling up retired healthcare workers to come and staff these field hospitals. So we're in a pause. We have a soft lockdown here in Rhode Island and across much of the United States, and patients are nervous. They're nervous about getting high quality medical care. They're nervous about whether they can even come to the hospital. So we're seeing a lot of patients decide to defer care, and then their conditions get worse. And as a physician, it's really a challenging situation to be in morally. Obviously, I want all of our citizens and immigrants to get the best care possible. And being in the situation where you're not adequately staffed is really challenging.
Yeah, I'm really sorry to hear that. But President-elect Biden, said he will ask all Americans to wear masks for 100 days, and he's appointing Anthony Fauci to be the chief medical advisor. I mean, what do you think about all this? I mean, do you think those will be of any help to medical professionals like you on the ground?
Yeah, I have to say that the scientists and the physicians in America are very much looking forward to this Biden transition. We have obviously been facing some misinformation, and we're looking for a much more robust public health response. I think a mask mandate would be one of the first things that we see out of the Biden administration, and I think that will absolutely help. Of course, getting the citizens to actually wear a mask is an entirely different story, and we have a lot of re-education to do on that topic.
Yeah, Elizabeth, I mean, I feel your pain. I mean, I relocated back from Washington, D.C. to Beijing a short few months ago. Good work over there, hanging there. Mr. Toker, let me go to you. And this, United Nations pandemic control meeting, it is really significant. One of the few of its kind these days. What are your expectations from these meetings?
Well, I would have liked very much to place hopes and realistic anticipations based on this General Assembly special meeting. I'm more cautious about it because, unfortunately, large international or large organizations as a whole are not sufficiently flexible and rapid to act in times of crisis. Now, I nuance all this because we're not starting. Unfortunately, the crisis has started about 9 months ago. So the entire planet has been through this crisis for a relatively long time now. But if you compare the flexibility and the capabilities to innovate and to find new solutions or to think out of the box, as they say, etc., international organizations are not really made for and are not the natural sort of relief. However, as we know what have happened over these last 9 months regarding the multilateralism, namely regarding the availability of the international community as a whole to cooperate, to exchange data, to exchange solutions, etc., here we should all hope that this special meeting of the UN would actually start a new phase, because we have seen, mainly due to the retreat of the United States, the decision taken by President Trump in the spring, the retreat from the World Health Organization, we saw a lot of damage, because this is, of course, the last thing one should hope at a moment of such an acute pandemic, that you would have the larger contributor to the World Health Organization and to some extent the largest scientific and medical community on earth to withdraw, right? So let's hope that that would mark what is happening these 2 days in the special meeting would mark a new phase.
Yeah, hopefully, people will see some solidarity eventually. Professor Fu Jun, let me go to you. The president of UN General Assembly, Volkan Bozkır, said this. He said, this is a test for multilateralism. There will not be a new, and also he said this, I want to really point it out for you. He said, this is a test for multilateralism. Do you think we're passing this test? I mean, there won't be a new administration in Washington until January the 20th.
He was very precise when he used the word test. When you do a test, it could be a win, it could be a failure, but I hope it will be a win. Now, the world is in trouble when we face a global problem, global challenge. Normally, when you face a global challenge, we should engage in multilateralism. But this time, because of the peculiarity of the United States, the country, by the way, has been very divided internally. And how to respond to the global challenge is very decisive divisive within the United States, and withdraw from the role of leadership of a special organization of the United Nations. In particularly, I'm talking about the World Health Organization, is an act by the Trump administration. And my hope is that with a new administration, the United States will coming back. After all, the United States continue to be a leader in many of the global challenges that we face, ranging from COVID-19 to climate change. And facing global challenge, we need to have collective action, and it's so important for the United States to come back. After all, in the wake of the Second World War, United States was playing a leading role in setting up this organization of multilateralism. At the time, people were pessimistic. But what transpired afterwards is that the world has come together to set up and run this organization. And with this organization, countries have accomplished so much, both politically and economically. And in this time for the challenge, it is so critical, and I hope the United States will come back. With the new administration, Biden probably will have a new approach. He appears to be more diplomatically skillful. When you see a range from unilateralism, multilateralism, plurilateralism, multilateralism, and better still, globalism, he probably is more inclined towards plurilateralism and the multilateralism when we face a global challenge, the pandemic and the climate change issue. Having said that, that does not mean it will be an easy party for China and the United States. So far as China is concerned, it has been working very hard to advocate multilateralism to face down the global challenges. Right. And there are so many things that the United States and China now do not see face with each other now.
Right, Biden really couldn't emphasize enough the concept of multilateralism. You know, in his interview with Thomas Friedman, for example, he said he will absolutely get each and every one of U.S. allies on the same page when it comes to dealing with China, as well as a whole host of other issues. Professor Toker, let me turn to you. We know the September 11th resolution was another one aimed at combating the COVID crisis. It was passed by an overwhelming majority of 169 out of 193 member countries and territories. Only the United States and Israel voted against it, namely the Trump administration. Why do you think the Trump administration would do that, and how damaging is it for the global collaboration against this pandemic?
Well, for once, one could listen to what President Trump indeed said and in a way trusted. The Trump administration stated it very clearly that they were withdrawing from the WHO, the World Health Organization, as sort of a punishment because they accused the organization, as we remember, as being too linked and too influenced by China. All this on the overall background of mutual accusations, mainly between China and the United States, but also other Western countries accusing China of lack of transparency and other deficiencies, mainly regarding the origins of the virus and the first few weeks or first few months of the pandemic. And there were, of course, revelations on the Chinese side which were countering it, and we're actually still in this kind of a mutual accusation across the globe as to who is indeed responsible for the arrival of the virus. And I guess this will still accompany us. Unfortunately, I don't believe that we're going to have a lot of transparency coming over, and we're going to find out some solid data on that very soon. But I'm not too worried about the fact that in September, namely about 2 months ago, before the U.S. elections, actually the Americans and the Israelis voted against the resolution because we are now in November. There is going to be a new president in about 45 days in America, and that will change. That had been addressed to in our conversation a bit earlier. So September is really, in this context, in a way, somehow an irrelevant past. Let's just hope that efficiency would characterize what the Americans in particular and the international community in general will be able to do in the coming weeks and months.
Right. Let's talk about China's role in all this. Chinese Foreign Minister and President Xi's Special Envoy Wang Yi expressed support for the WHO's leadership in fighting the pandemic. Actually, he made promise that China's vaccine rollout will be made a global public good. I want you to listen to what he said earlier.
We have launched the largest global humanitarian initiative and the largest virtual exchanges and sharing of pandemic prevention information since the founding of the People's Republic of China. We have assumed responsibility as the world's largest supplier of virus prevention materials. We will continue to provide support and assistance to countries in need. We are currently speeding up Phase 3 clinical trials of the vaccine. Once it is developed and put into use, we will actively provide it to developing countries as a global public good.
Professor Fu Jun, your thoughts on China's role in the fight against COVID so far?
Well, I think China now probably have a good mix of state and the market when it comes to fighting against the pandemic. We can take the pandemic as a case of fatal externality, where you do need to have a very strong role played by the state. So in this particular case, initial evidence shows China has survived, if that's the word to use, the pandemic relatively well than others. Now, long term, that does not mean that China should stay within an economy that is state dominant. It need to continue to go from a relatively state-dominant economy to a market-oriented economy. But in this particular case, as I said, we seems to have a good mix between the two parts, the state and the market. Once we have done with this phase, I hope we will have a relatively quick recovery of the economy, because after all, it's so important. Once you have health, you also need to have wealth for the global economy to move forward. And for China itself to continue to grow, we need to deepen our reforms, which is a market-oriented reforms, and also to for the state to play a appropriate role in the marketplace that need to be backed up by a system that we call rule of law system. Now, without the clarification of those prospects, it generates a lot of suspicion around the world. China has been a beneficiary of the global system, the liberal global system.
Right.
And for the world economy to move forward, and for us to collectively fight this pandemic, we need to continue that system. And what role China can play is to pick up the shortfalls so that we can make appropriate contribution to a system that based on multilateralism.
Right. Professor Fu, thanks so much for your insight. I want to move on and talk about the rollout of vaccines. Professor Goldberg, as a frontline worker, what do you feel about all this? I mean, what kind of vaccine rollout do you want to see, I mean, not just in the United States, but across the world? I mean, developed countries versus less developed countries in the different regions and areas. What do you think?
Yeah, I think we've heard two different approaches. The first approach being every population, every state, every country should receive 2 or 3%, an equal percentage of the vaccine as we roll it out. And the other contrary view is there are places in the world right now that have COVID very much under control. So, New Zealand, China. If we want to really prevent deaths, does it make sense to roll out in the countries that have good control right now? And so I'm very conflicted about that. I think we need an equitable distribution. As a frontline worker myself, I still experience a lot of anxiety and fear going into work, and I know now, especially with staffing shortages, that it's so important to keep us healthy so that we can care for the people around us. And you also never know when the next outbreak may occur. We had very good control here over the summer and in between our two surges, and at that time maybe you could have thought that we didn't need a vaccine right away, but now it's very clear that that situation can change at any moment. And now after the Thanksgiving holiday, we're really seeing a very steep climb in cases. And as you know, the vaccine requires 2 doses, 3 to 4 weeks apart, and so you really need to plan in advance. The distribution is very tricky because of how low temperature the mRNA vaccines need to be. And so it requires a lot of advanced planning. And every day here in the United States and across the world, really, there's planning about how we can distribute this equitably. And and ensure that the vaccine arrives in good quality.
Right, it is a fluid situation in the United States. And Professor Toker, I mean, what do you think? Fairness, being fair, of course, I think is a loaded word. I mean, it depends on how you define fairness, but after all, what do you think is perhaps the fairest or most equitable way of distributing vaccines when they become available?
Sure enough,
I
I'm
share
also
the-
tempted
Oh, sorry,
to
Professor
use
Goldberg. I was asking Professor Toker in Paris. Yeah, Professor
Oh.
Toker, go ahead.
Okay, yeah, sorry, I would have liked so much to refer to values and adjectives such as fairness and efficiency, but mainly fairness and ethical type considerations. But I'm realistic. I know, or I pretend to know a little bit the way some things about the way governments behave, and especially about the way governments behave under pressure, and under very uncomfortable pressure, and under circumstances which are those of crisis, and crisis perhaps of one of the worst types, namely crisis which is really not just metaphorically a question of life and death due to the pandemic and due to the mystery and so many unknown elements that the science still have not answered, so we can master, at least intellectually, and know and have a feeling and confidence that we know what is happening, let it be better or worse. So under these circumstances, I'm afraid that the human race, world population, world government will not be too excellent in employing, you know, values such as fairness, and will take too much into consideration the fact that there are, of course, wealth disparities and other disparities between more wealthier countries and less wealthy countries, although of course you'd find in the public discourse of political leaders around the world references to that, and that's very well. Of course, there are other considerations, such as the one Professor Goldberg in the States just mentioned, the fact that in terms of sanitary considerations, what should be the criteria to be valid? Are those, should those be conditioned or linked to the state of control, to the level of control of the pandemic in a specific country or a specific region? Or should that be just on the basis of the size of the population and the possibility in terms of logistics? Because this might be right now the greatest challenge in terms of public powers. How would you distribute and administrate the millions and billions of doses to the individuals who need them all across the globe?
Right, it is a thought-provoking question that you raised over there. We understand that I have Eric Ding over there, epidemiologist based in Washington, D.C. Eric, so good to see you again. According to data from Citibank, 85% of coronavirus vaccines have been booked already by developed countries, such as the United States, United Kingdom, Japan, the European Union. What about less developed countries? I mean, are you worried about the distribution and rollout of vaccines?
Yeah, absolutely. And the distribution is why the WHO set up COVAX, and also why they've been furiously trying to fund the ACT Accelerator program with $28 billion right now gaping hole, because you really need to solve this pandemic for the whole world, not just for developing countries, as we all know, because if you don't solve in the rest of the world, it's going to come back and bite the more developed world, and that's a very short-sighted approach. That said, the vaccines so far mostly have been, you know, between Oxford, the Pfizer, and Moderna, have been either Warp Speed funded or UK funded, so they were pre-purchased in many ways. But we have many other vaccines coming on the line. You know, China obviously has its own vaccines, but it's still waiting on phase 3 trial. And there's several other vaccines that are actually much cheaper, do not require freezing, just like the AstraZeneca one, and requires only one dose. The AstraZeneca Oxford one requires 2 doses, and those might actually be better for developing countries. So I'm hopeful that these other vaccines will also be effective and that be much more readily accessible for the rest of the world.
Right. You know, there's technical difficulties too. For example, the storage environment of vaccines also has a great impact on vaccination plans. For example, the Pfizer vaccine needs storage at around -70 Celsius and will be transported in special boxes of up to 5,000 doses packed in dry ice. Once out of the fridge, it needs to be used within 6 hours. And that makes it really difficult to be transferred from, you know, especially to remote areas, you know. So for these countries and regions, how can those issues be resolved, Eric?
Well, I think for some cold chains, I'm really worried that the Pfizer vaccine may not be appropriate for developing countries. But first, because it's 8 to 10 times more expensive than the AstraZeneca one, and B, because of the cold chain requirements. And also, again, some vaccines that require 2 doses will be much, like many folds more expensive to implement and roll out than a single dose, non-freezing, inexpensive vaccine. And I think the single dose non-freezing ones, the Johnson & Johnson vaccine is one of those, and it's in the pipeline. Their phase 3 is finishing soon. I think those single dose, cheap, inexpensive, non-freezing ones that only require refrigeration will be the magical vaccine for a lot of parts of the world where -70 degrees or even any freezing level, like the Moderna one also requires. I think we need really logistically feasible one. And I think the rest of the world really needs that very soon.
Professor Goldberg, I'm sure you and your colleagues have been monitoring different vaccine candidates. So what is the situation? I mean, what do you think of the vaccine candidates so far?
So I've been very closely monitoring them and obviously excited for the moment that I can get myself vaccinated and you know, all my patients vaccinated. What the main conversation has been here locally is Moderna and the Pfizer vaccine. It does look like Pfizer is going to be rolled out first. It's probably going to get FDA approval first. It's already been approved in the UK. And the CEO of our hospital system has said that we may receive the vaccine as soon as next week. And of course, we're a very resource-rich hospital system. We're a large academic medical center, so we have those -80-degree freezers at Brown University and Lifespan, our hospital affiliate. So it's easier for us to receive those. But I think there's still some vaccine skepticism that we're going to need to overcome, and there's still questions about the order in which people will receive the vaccine. And we know that in 2020 at least, we're not going to have even all the healthcare workers and all the long-term care facility workers and residents vaccinated. So we're still looking at a pretty gruesome winter.
Well, hopefully the winter will not be so gruesome as you know, in the coming weeks and months. And for you and your colleagues, thanks so much. Professor Toker, thank you. And Eric, good to talk to you as always. And that will do it for this edition of Dialogue. Thank you so much for watching. I'm Wang Wen in Beijing. I'll see you again soon.